Hello and welcome everyone. We are on week 8 and lecture number 38. In lecture 38, we will discuss secondary injury prevention and neuromuscular training post return to play. The objectives of today's lecture are 1. To define secondary injury prevention in the context of knee ligament injuries. 2. To understand the high risk of re-injury following return to play. Third, we will also learn the principles and components of neuromuscular training or NMT. Fourth, to explore evidence-based NMT programs that reduce re-injury rates. And fifth, we shall apply practical guidelines for integrating prevention drills into post-return to play training. The first comeback for an injured athlete is never easy, and it's not the only risk. Athletes often re-injure themselves when they return too soon or unprepared after a significant injury. Even though it is the ligament that was injured, prevention of re-injury starts with retraining of the movement and not with the healing of the ligament. Neuromuscular drills rebuild movement control under fatigue and chaos. The goal is to make safe movement patterns automatic and involuntary for the athlete. Let us now explore how these programs extend careers beyond the first return after injury. Many sportspersons and even many rehab teams believe that RTP is the final goal, and it is here that their job with the athlete comes to an end. Well, it is not so. Returning to play is not the finish line. It is just the beginning of the most vulnerable period for an athlete, especially a young athlete. In cases of premature return to play, it was observed that young athletes face re-injury rates between 20 to 30%. These secondary injuries are often of greater severity than the first injury. Studies show that prevention programs can cut this risk in half, making secondary prevention essential. In subsequent slides, we will try to understand the components of these prevention programs. Let us first define secondary injury. A secondary injury refers to a new injury occurring after an athlete has undergone an ACL reconstruction or a rehabilitation and returned to activity or sport. The injury can be other than ACL as well, maybe an MCL, an LCL, a meniscus, or even a PCL injury. The injuries include ipsilateral graft rupture or re-tear of the reconstructed ACL. The incidence of this being 6 to 12%. This injury also includes contralateral ACL tear, which is new injury in the uninjured knee, with incidence being between 8 to 12%. Apart from these, we also have associated injuries such as meniscal tears, cartilage lesions, or collateral ligament injuries sustained during return to sport. Secondary injuries typically occur within the first 2 years of return to play, with younger athletes and those returning to pivoting sports being at highest risk. re-injury is often due to modifiable factors. Quadriceps or hamstring deficits remain even after clearance to play. Poor neuromuscular control, such as valgus collapse or trunk leaning, predisposes the knee to overload. Psychological fear can alter movement mechanics. Fatigue and poor load management further magnifies the risk. Preventing secondary injury is a major focus of modern neuromuscular training. Criteria-based return to sport testing and long-term injury prevention programs. Neuromuscular training is about retraining how the body moves. As discussed previously, the proprioception receptors of the joint are destroyed after significant knee injury. The repetitive exercises in the rehabilitation phase helps to develop the neuromuscular control and the neural pathways to the brain. And hence, the movement from before the injury can be replicated again. Neuromuscular training, or NMT, combines proprioception, reflex control, balance, agility, and core stability. The emphasis is on movement quality, teaching the athlete to land softly, cut safely, and react with controlled alignment under dynamic loads. The specific exercises for each are discussed later in today's lecture. The evidence for programs like FIFA 11 Plus and similar warm-up programs is very strong. The FIFA 11 Plus is a structured injury prevention warm-up program developed by FIFA's Medical Assessment and Research Center. It is also called as the F-Mark. It consists of 15 exercises focusing on running drills, strength, balance, plyometrics, and agility. These exercises are designed to replace the traditional warm-up. Research shows it can reduce overall football injuries by 30 to 50%, with significant effects on knee and ankle injury prevention, the two most common injuries in football. The program is simple. It requires no equipment, and it is recommended for football players at all levels, grassroots levels and elite level alike. Meta-analysis confirm the effect of structured warm-up protocols across different sports. Importantly, after return to play, continuing neuromuscular training reduces re-injury rates by more than 50%. This makes ongoing prevention an evidence-based necessity. The NMT training protocol are pillars of prevention. These include: first, balance training to train proprioception and coordination. Secondly, it includes plyometrics. Plyometrics with correct landing exercises to train power and neuromuscular control also forms a part of NMT training. Thirdly, it includes strengthening of the posterior kinetic chain and core. This helps to improve the posture and decrease the injury to peripheral structures. Fourth, agility drills are also a part of NMT training. Agility drills are performed to train movement of the sport. As you can see, each element addresses a different risk factor, and together they build a resilience against re-injury. Let us now expand upon each of these components of neuromuscular training. Firstly is balance and proprioception drills. Simple exercises like single leg stance with perturbations or wobble board drills enhance joint reflexes. The Y balance test discussed in the previous lecture can be turned into a training exercise. These drills sharpen proprioception and improve reflexive stability, reducing unexpected collapses under load. These exercises are helpful when training on uneven surface. These exercises also help when an athlete loses his balance while performing a sport-specific activity. For example, consider the sport of football. When a player jumps to head a ball in midair, he or she is not the only one competing for the possession of the ball. There are other players of opposing team who also try to head the ball. The mid-air pushing and shoving may lead a player to land awkwardly. Thus, it may result in a knee injury. A trained player would be able to still maintain his stability and even after a mid-air push will still be able to land on his feet without injuring his knee. Plyometrics are explosive exercises that use the stretch shortening cycle of muscles to improve power, speed, and neuromuscular control. In rehabilitation, plyometrics help restore dynamic stability, improve landing mechanics, and improve sport-specific performance after knee injuries. Evidence supports their role in enhancing return to sport readiness and reducing re-injury risk when they are introduced progressively. We start with low intensity plyometrics like skipping a jump rope or jump squats before gradually progressing to more demanding plyometrics like obstacle jumps, vertical box jumps, etc. We subsequently progress to more sport-specific movements like horizontal bounds and finally to multi-directional hops, something which is replicated in a sport like football, basketball, volleyball, hockey, etc. The focus while performing plyometrics is on knee alignment without valgus collapse. It's also on controlled trunk alignment and symmetrical loading of both legs. Agility training replicates game scenarios. Agility is the ability to rapidly change direction or speed in response to a stimulus while maintaining control and balance. It requires an integration of strength, power, coordination, and neuromuscular control. Agility is not only about planned movements but also involves reactive decision making in unpredictable environments. In rehabilitation, agility testing and training are key milestones for a return to sport clearance, especially in pivoting and cutting sports. Cone drills and shuttle runs build speed and control. Planned cutting drills evaluate biomechanical control in known directional changes, while unplanned cutting tasks measure reactive agility to sudden cues provided by the coach or the trainer. Mirror drills are similar to unplanned cutting tasks. In this activity, the athlete mirrors the task of his trainer. Deceleration drills test ability to safely absorb force and decelerate. Teaching athletes to slow down under control is just as important as speeding up. Neuromuscular training refers to structured exercises aimed at improving balance, proprioception, muscle activation, and movement control. It is designed to retrain the nervous system to produce safe, efficient, and coordinated movements, especially after injury. It also serves as a cornerstone of secondary injury prevention, particularly following ACL and other knee ligament injuries. Neuromuscular training has been shown to significantly reduce ACL re-injury risk and improve long-term functional outcomes in athletes. The optimal timing for NMT is during the warm-up phase of training or rehabilitation sessions when the neuromuscular system is fresh and receptive. Warm-up integration ensures NMT is performed consistently without adding excessive training time to the athlete's training program. This training should also be progressively integrated into sport-specific drills later in the workout, especially with reactive and agility components. For sustained benefit, NMT must be a long-term component of an athlete's training routine and not just part of early rehabilitation. Integration is most effective when coaches, physiotherapists, and strength trainers collaborate to embed NMT into routine conditioning, warm-ups, and skill training. A 15 to 20 minute structured warm-up performed 2 to 3 times per week is sufficient to maintain the benefit of neuromuscular training. In this slide, we will discuss about some of the common barriers encountered during rehabilitation. First is an athlete compliance is often low. This is because once athlete starts feeling pain-free, they tend to abandon preventive or maintenance exercises. The solution to this problem is to educate athletes that re-injury rates are highest in the first 2 years and ongoing neuromuscular training reduces this risk up to 50%. 1 in every 4 athletes after an ACL is likely to get re-injured. The second barrier is long-term prevention programs are perceived as boring or repetitive, reducing the motivation of the athletes. The solution to this is integrating prevention program into engaging warm-ups, for example like the FIFA 11+, or to use competitive game-specific drills to keep the athletes engaged. Third barrier is that athletes prioritize performance drills over injury prevention exercises, believing that prevention exercises delay their skill development and skill training. The solution to this is to blend neuromuscular training into sport-specific drills so the training time and load of the athlete is not compromised. Another barrier is that coaches and trainers may undervalue prevention, focusing more on conditioning and tactical drills. The solution to this is to provide evidence-based workshop for coaches highlighting re-injury risk and prevention benefits. Next barrier is the strength and conditioning staff may not coordinate with the medical teams. This may lead to a fragmented rehab to performance transition. The solution to this is to create a multidisciplinary return to play pathway with shared criteria like functional tests along with psychological readiness. With this, we come to the end of this lecture. The key takeaways from today's lecture are that secondary prevention is critical post return to play. The risk of re-injury in the first 2 years is very high, and hence this makes the secondary prevention an essential part of the rehabilitation. The neuromuscular training addresses modifiable risk factors, and since they are modifiable, these injuries are preventable as well. Sustainable programs require integration into training culture. There has to be a mix of sport-specific training as well as neuromuscular training while performing the exercises for an athlete who has sustained a significant knee injury or has returned back to sport after a knee surgery. These are some of the references I have used in today's lecture. With this, we come to the end of lecture number 38. Thank you and goodbye. I'll see you the next time.